We're back with Renee Graziano from the hit VH1 series Mob Wives. Joining us now is the one and only, my friend of the show, Dr. Drew Pinsky is in the house. And as you all know, Dr. Drew is both an internist and an addiction specialist. He is also host of numerous popular podcasts, including Dr. Drew After Dark. Hi there, Dr. Drew. How are you, my friend?
I'm great. It's great to see you guys.
So I understand you two have a long history. Tell us more about that, Dr. Drew.
So Renee and I got to know each other. I can't remember really how. We ended up at her uncle's restaurant in Staten Island, and then I hosted one of the Mob Wives reunions. And at that time, Renee, you were very concerned about your son. So I hear he's doing great now. Congratulations on that.
Thank you. My son is married with 2 children.
That's what I heard. He's doing fantastic.
Congratulations.
Yeah. But you have been struggling for a long time. And a couple of things. First of all, let me be the first person to say, I'm so grateful and so glad you are alive. If no one is saying that to you, you deserve only the best wishes for having been through what you've been through. And I, for one, and I know Susan, my wife, is also. Now, and as my namesake, the other Dr. Drew alluded, we're very concerned about this anterograde and retrograde amnesia you had, because that suggests a real head injury. Or, as the press likes to put it, somebody with addiction must be on drugs. Well, that's not necessarily the case. So let's do a little checkup on your drug addiction, okay? You want to do that? All right. So one of the little secrets about a drug treatment is it takes, on average, 4 treatments and 5 years even for an alcoholic to get 1 year of sobriety. So to need recurrent treatments is not at all uncommon. That's number one. Number two, the fact that you are prescribed medication, Renee, that does not mean you should be taking the medicine when you're a drug addict. Think about the time you spent in treatment. Think how many people were there because doctors prescribe them medication. So be very careful of the medical system is all I'm saying. You're a benzodiazepine addict. You've required treatment for benzodiazepines. Ambien is a benzodiazepine. So I'm very, very, very concerned about that. And you spent months in treatment, and I'm sure you had a sponsor. I'm sure you're going to meetings. Are you doing that now?
I speak with my therapist daily. I do have a sponsor. And as far as the Ambien, we cut my Ambien CR 12.5 down to half a month, because there are days that if I do not sleep, I am the most erratic person out there. I know for me, if I don't sleep, I'm no good to.
I get it. And I get you. I'm not saying that should be diminished how you suffer with that and how profound that problem is.